Hello, and welcome to I Got You, your go-to for honest, simple conversations about vision, eye health, and general wellness. I'm your host, Dr. Valarie Jerome, optometrist and total eye nerd. No jargon, no hype, just real talk, grounded in care and expertise. Because your eyes matter, and so do you. This is a space where you're going to feel heard, seen, and supported, and you're going to get some information that you can actually use. So don't worry, I got you. Hello, and welcome to I Got You. I'm your host, Dr. Valarie Jerome, optometrist and total eye nerd. And today we're going to be debunking the common myths about contact lenses. Now, I've had countless conversations with patients, with family, and friends about contact lenses. And I can tell you, there is a lot of people out there with a lot of wrong information about contact lenses. So today, I'm going to set the record straight. I'm going to walk you through the things that I hear most often and what the truth really is. If you've ever been frustrated with your contacts, if you've wondered if contact lenses are right for you, or you've thought about giving up on contacts, this episode is especially for you. So here's myth number one. I don't wear my contacts because they're uncomfortable, but I hear that that's normal. Actually, that's false. That's not normal at all. Contact lenses should not feel uncomfortable. In fact, a good contact lens should feel comfortable. It should feel just as good at 9 o'clock at night as it did at 9 o'clock in the morning. If you're experiencing any discomfort with your contact lens, it means that probably you're in the wrong lens for your eye shape, maybe the wrong material of the lens, maybe you've got an underlying eye condition like dry eyes or eye allergies that's affecting your contact lens wear, and that's all something that we can fix. And here's myth number two. My optometrist, my contact lens optician, only had one option for me, so that must be it. Well, here's something that people don't always realize, and this is a little industry secret. So many high street opticians, many chain opticals always have this go-to lens from a specific manufacturer. And this is often based more on profit margins than on patient comfort. So you are not stuck with one option. For most people, there's not one option. If your lenses are not working for you, you need to ask for alternatives. You absolutely have the right to speak up and find a contact lens that suits you better. And here's myth number three. What's the point of wearing contacts if I can only wear them for a few hours a day? Now, this is a great question, and it's something that I hear often. People say, I've been fitted in contacts. I'm told I only can wear them 6 hours, 8 hours, 12 hours. So here's the deal. Most contact lenses are designed to be worn from the moment you wake up to the moment you go to bed, and some are actually approved for extended wear, meaning you can sleep in them. Now, if you have dry eyes or allergies, you might find that there's some limitations on your contact lens use, but there's ways that we can treat your dry eyes and treat your allergies to get you comfortable. Now, there are daily disposables, extended wear options, and even custom lenses. They're all designed to fit your needs. The key is to find what works for you. And myth number four, I can't wear contacts because they don't make them in my prescription. Almost everyone can wear contact lenses. If your prescription is more complex or your eyes have unique needs, if you have keratoconus or corneal scars, you might require specialty contact lenses, and that's where an independent optometrist or specialist contact lens optician can really help. Unlike many of the high street chains, independent optometrists and specialist contact lens opticians often have access to a wider range of contact lens designs and materials. Trust me, there are more options than you think. And myth number five, can I just order my contacts online? What's the point of having an eye exam? Well, this is a big one and a bit of a sore spot for me because let me just say this. A contact lens is a medical device, and in the UK, it must be fitted and prescribed by a qualified professional. Many online retailers, especially those that are based overseas or offshore, they may skip those safeguards, and that's risky. And I've seen patients with corneal infections, irritation, even long-term vision damage to their cornea from wearing these poorly fitted, cheap contact lenses that they've self-prescribed online. There's a particular brand, when a patient shows up with it, I know they're going to have trouble. Now, your eye health is too important to risk for convenience. Myth number 6, kids can't wear contacts. Their eyes are still growing and they're too young. They'll never be able to do it. That is a big myth. I have personally fit very small children with contact lenses for specific visual needs. Of course, now when we're talking about fitting kids with contact lenses, parents are going to be responsible for cleaning and handling and overseeing. I found often that kids surprise us. They're capable, adaptable, and sometimes handle those contact lenses better than the adults. I had a case once where a kid came in with her dad. She ended up doing better with the contacts than her dad did. Now, there's also myopia management, where we fit contact lenses in children on children's eyes to help slow down their short-sightedness, and they sometimes can be a better choice than glasses. And here's myth number 7. I don't need to wash my hands before removing my contacts. Yes, you do. That's one simple but crucial thing. Okay, always wash your hands before you put the contact lens in and before you take it out of your eye. Now, washing your hands is one of the easiest ways to avoid eye infections. And trust me, you don't want to learn that the hard way. So I hope you learned a lot today about myths with contact lenses. One other big myth is, will I get this contact lens stuck behind my eye? No, that's another myth. It doesn't get stuck behind the eye. So remember, whether you're a seasoned contact lens wearer or you're just thinking about giving them a try, I hope today's episode helped clear up some of that confusion and give you a little more confidence about your contact lens options. And don't forget, if you've got a question that I didn't answer today, please leave a comment so that others can benefit too. And if you found this podcast to be helpful, please consider leaving a review or sharing it with someone who's been on the fence about contact lenses. I absolutely love to help people feel more comfortable and more confident about their vision. Thank you so much for listening to I Got You. I'm Dr. Valarie Jerome, and I've got you and your eyes covered. Thank you so very much for listening to the I Got You podcast with myself, Dr. Valarie Jerome. Just a little reminder, everything that we chat about here on this podcast is for info and entertainment purposes only. So if something's a little blurry, itchy, or not quite right with your eyes, book in an eye exam with your eye care provider. Take care of yourself and take care of your eyes.